Look good on your lunch hour. Sponsored by the Advanced Cosmetic Surgery and Laser Center.
In Look Good on Your Lunch Hour today, they are called hooded eyes, and a procedure to fix these hooded eyes, pretty popular these days. Joining us now to explain just how it works, Dr. Jon Mendelsohn of the Advanced Cosmetic Surgery and Laser Center. I know you recently had the procedure yourself. How you feeling?
I am feeling well. Yes, June 8th, about 3 months ago, I had an upper blepharoplasty, and I've recovered pretty well. Here I am.
So tell me about that. What is an upper blepharoplasty?
Yeah, so an upper eyelid surgery is a procedure. You know, we all begin to lose elasticity. We begin to we lose some volume, and our eyes just don't look as refreshed as they once did. So an upper blepharoplasty is a procedure performed under local anesthesia. It takes under 30 minutes. And very simply, what will happen is we will mark where the natural eyelid crease is, usually about 8 to 10 millimeters from our eyelash margin. We'll even those up. Yep, you're seeing that right there. And so then, so if one crease is at 9 millimeters, the other is at 10, we'll make them both 9.5. We'll measure the redundant tissue, as you can see there. You can see my hooding. And very simply then, the area is localized, a tiny little injection to numb it up. My eyelids look a little bit white there because there's epinephrine in the solution to help prevent any bleeding. And the tissue is removed, sometimes a little fat is removed, and then one stitch goes from my nose towards the corner there, towards the outside where you just saw Dr. Gaynor place the suture. And that stays there for about a week, and we remove that, and things just continue to improve day by day. This is a procedure that lasts probably 20 years. It could be a once-in-a-lifetime procedure. That's not always the case. We want to be appropriately conservative, but we are looking for an aesthetic that is a cosmetic result. It's not always just about function. There are some people who have hooding and they can't see, but many times our patients are coming in really desiring also to look more refreshed. And it is simply one of the best procedures anybody can have performed in their lifetime. I've been talking about having mine done for almost 20 years, and I finally pulled the trigger.
Okay, so last thing, then we have a couple of your befores and afters. You've had a few complications. Let's not ignore that. What can go wrong?
Okay, well, we'll talk about it. So, you know, by the way, on our website, Advanced Cosmetic Surgery and Laser Center, if you go to YouTube, actually our YouTube, not our website, I've got a playlist of things. And so I'm very candid about this. I've gone day by day. What I did, my friend, we went out to dinner. I may have had a cocktail or two, and I separated my left eyelid shortly after the procedure, which was that evening. So came in the following morning, and it required a few more sutures. So there was a little bit of a delay. Oddly enough, I think I mentioned this to you before, my family, my daughter, all of my family didn't even say a word less than 2 weeks following this when they saw me, which is incredible that they didn't notice. Yeah, you can see the results there. It's refreshing. This isn't a Kenny Rogers, for those that know Kenny Rogers. This is really just removing some of the redundant tissue. In men, we want to be a little bit more conservative, so it's natural. In women, we still want it to be natural, but we remove a little bit more from the temporal area to open up that eye to the rest of the face.
Okay, I'm going to put up a phone number, 513-351-3223. We'll let people reach out to you if they want to learn a little bit more. And as I recall, it lasts about 20 years, and it costs roughly, give me a range there, John.
Yeah, probably about $5,000 to $7,000. It depends exactly what we're doing.
Yeah. All right. Well, I have to say your results look really good. Great to see you again.
Thank you very much. I appreciate that. Thank you, Liz.
All right. Thanks, John. All right. Just